The low-carb diet is defined by the UK Diabetes Organization as a diet where there is a reduction in the consumption of carbohydrates, with less than 130 grams of this macronutrient to be ingested per day. Since this amount of carbohydrates represents only 26% of the energy needed by the body, the rest must be provided by the consumption of good fats and proteins. In addition to this diet, there is another one, known as a ketogenic diet, in which the amount of carbohydrates ingested is even smaller, being between 20 and 50 grams per day, which causes the body to enter a state known as ketosis, in which it starts to use fats as the main source of energy instead of carbohydrates. However, this diet is very restrictive and is only indicated in income cases. Better understand how the ketogenic diet is and when it can be indicated. The low-carb diet is very efficient to lose weight because the metabolism starts to work better with the increase of proteins and good fat in the diet, also helping to reduce the inflammation of the organism and to fight fluid retention. Health benefits following a low-carb diet can have several health benefits such as giving greater satiety, since the increase in the consumption of proteins and fats keeps hunger away for longer, regular control of cholesterol and triglyceride levels, as well as increasing good HDL cholesterol, reducing the risk of cardiovascular diseases, help control diabetes by regulating blood sugar, improve bowel function by containing more fiber-rich foods, favor weight loss due to reduced calories, increased fiber content and glycemic control, combat fluid retention by stimulating urine production, eliminating excess fluid accumulated in the body. However, to make this type of diet safe, it is very important to have guidance from a nutritionist since the calculation of carbohydrates varies according to the needs of each person and their history. In addition, the nutritionist can also help to recognize the number of carbohydrates present in each food so as not to exceed the established daily limit. To make the low-carb diet, you should remove especially simple carbohydrates from your diets, such as sugar, refined flour, soft drinks, and sweets. In addition, and depending on the number of carbohydrates you are trying to target, it may also be necessary to restrict the consumption of complex carbohydrates, such as bread, oats, rice, or pasta, for example. The amount of carbohydrates that must be eliminated from the diet varies according to the metabolism of each one. A normal diet is usually high in carbohydrates, including about 250 grams daily, and for this reason, the low-carb diet should be done progressively so that the body gets used and side effects such as headaches, dizziness, or changes in mood. Important that 3 main meals and 2 snacks are eaten on this diet to allow the consumption of small portions of food throughout the day, reducing the feeling of hunger. These snacks should include eggs, cheese, nuts, avocado, and coconut, for example. Lunch and dinner should be rich in salad, protein, and oil, and may have only little carbohydrates. The foods allowed in the low-carb diet are fruits and vegetables in small quantities, preferably raw, with skin and bagasse, to increase the amount of fiber and improve the feeling of satiety. Lean meats, especially chicken or turkey, without skin. Fish, preferably the fatty ones like salmon, tuna, trout, or sardines. Eggs and cheese. Olive oil, coconut oil, and butter. Nuts, almonds, hazelnuts, Brazil nuts, and peanuts. Seeds in general, such as chia,
flaxseed, sunflower, and sesame, unsweetened coffee and teas. In the case of cheese, milk, and yogurt, it is important to control the quantities correctly. Milk can be substituted for coconut or almond milk, whose carbohydrate content is much lower. It is also important to follow the low-carb diet with 2 to 3 liters of water per day.